A friend of mine wanted me to do a video about how psychiatric medication causes the loss of one's ability to control one's actions. This is an interesting aspect of psychiatric medication. Now, I want to be clear. I am not a doctor. I am not a psychiatrist, a therapist, or anybody that should be given medical advice to people in a mental health crisis. And that's what I want to make clear. Not a doctor, not a therapist, not a psychiatrist, not a witch doctor, nothing like that. Okay, but what is interesting is a lot of these mass shootings and things of that nature, the people were under the care of a psychiatric or mental health professional. Why is this important? Okay, I made a video about how psychiatric medication wrecked my body. Okay, and I was lucky enough to have somebody that realized that. And it made my triglycerides go up, my cholesterol go up, and put me into a very bad state of health at a very young age. What I don't usually talk about is how it affected my mind during that time. I was always known, especially as a youth, to have a very bad anger problem. What is interesting is I was also on psychiatric medication. One of the things that was most easy for me to, most quickly, to come to the conclusion that this is, that I was off the medication was I regained control of my thoughts and gained control of my ability to control myself. I no longer was as quick to anger or as quick to act without thinking as I was on the medications. Now, to be fair, I was on some very powerful medications such as Thorazine, Haldol. Haldol, for example, is actually illegal in most countries, including the former Soviet Union, where it was used to torture people. But it's legal in the U.S. However, what my point is working in mental health. I want to also make this clear. I don't think most psychiatrists, I know none of the psychiatrists I worked with at my community mental health clinic had the intention to harm anybody. But I do believe all psychiatrists have a God complex at some point in time. They develop a God complex that they know better than anyone else. And this is just not the case, as these medications, nobody really knows how they're going to react in the person. And they're not studied in such a way that you can know how 5 different medications are going to interact with somebody's individual biochemistry. What I will say is this: every one of my clients, when I worked at a community mental health clinic, had at least one adverse reaction to the medication. And when people say that this medication helps them gain control or things of this nature, they are either convinced by their therapist or doctor that they have a better degree of control, or they are lying to themselves. I do not know one person that did not have a severe emotional reaction to the medication they were on. And if you read the warnings on the medications, they increase suicidality, they increase homicidal ideation. These medications make people crazy. They don't stop you from being crazy. Now, that being said, I would never suggest that somebody just stop a medication, because these are physically addicting substances most of the time. So if you were to try and stop one of these medications, you would have physical withdrawal symptoms that could very well kill you, or at least cause convulsions and things, very nasty side effects. So it is kind of a catch-22. A lot of people are ignorant of these things because they want to believe that there's help out there for behavioral issues. And it is sad, very, very sad, I must say, because behavioral health issues are a real concern. However, the practice of behavioral health medicine is not really helping anybody. And I do wish, I wish that people that formerly worked in mental health would just come out and say what they've seen. I know plenty of people that worked in mental health that had to quit and get involved in other things like massage therapy or whatever the hell they got involved in just to make money so that they did not have to do this highly immoral and unethical form of work. And I wish more people would come out and say what they saw and what they honestly know was going on. Because if everybody that worked in that field came out, there would be a hell of a lot less ability for people to call people crazy because they're saying what is really going on in the mental health field.